thank you for inviting me. And I definitely feel like a bit of a fraud being on this panel with everyone else here. I'm just kind of for research use only and have no clinical purpose. So, quick introduction to what I'm kind of hoping to present today, because it's a little bit the opposite, or maybe a counter to what we had in the just previous presentation. So, I definitely don't disagree that there's a place for having easier access on a device that you can just pick up on a smartphone. But my argument here is why, or at least presentation is going to be about why stereoscopic viewing is important. So why I think we shouldn't lose the focus on using head-mounted displays, or indeed other 3D screens. So really quick background, my undergrad was orthoptics, so I worked in clinical outpatients, but what we did was look around for children that couldn't see in one eye. So they were blind in one eye, could see perfectly well in the other. So we'd go around, find the eye that they could see better with, put a patch on it in order to train them to use their other eye. We were aiming to get binocular vision back if we could, but that wasn't always possible. But some of these children still reported when they were seeing 3D films that they could appreciate depth. Their parents were describing how they were moving out the way of it, although they were supposedly stereo blind. But what I actually kind of went on to do, and that was my research background, was actually discovering that there is a mechanism that's different to our static stereo cue that we use in the clinic. To measure 3D depth perception in the clinic. So this is an STL of a CT scan that I've pulled up into Medicalholodeck. So if you're looking at this image, it should hopefully keep spinning round. When you're looking at that, it might appear 3D and volumetric on the screen, but to actually improve that, if you've got it on full screen and quite a dark background, if you shut one eye and look at it, and stare right towards the center of it, it should appear more that it's volumetric. So even without a stereo view, with a monocular view, with one eye covered up, it should appear more 3D. I'm hoping I'm not just convincing myself of that. So actually, kind of what I'm saying there is that maybe one eye is all we need. So in that case, looking at a flat screen on your iPhone is pretty good. And if you try this anytime you see a really fantastic looking scene on a TV, if you close one eye, use your stronger eye, you will get more of the depth perception. And I can go on for ages talking about why that is, but I won't bore you with that today. Now, here's a red dot on the screen. Now, those of you that are at home on a laptop, if you put your finger on the red dot and then keep watching the red dot and move your finger back towards you, you'll hopefully notice that whilst you're still looking at the red dot, you see two fingers. If you're in a larger space, if you look in the distance, try and put your finger underneath the red dot and you'll see you've got two fingers. Look at your finger, you'll see two red dots in the background. So actually, all the time, we are using both eyes together. And that's assuming we're not stereo blind, but if we're using both eyes together, we actually always get double. So when we're looking at a flat screen with both eyes, there's a conflict. So when we go back and look at this with two eyes open, we know that that's a flat screen because the disparity cue is there telling us that that's the case. If we get rid of the disparity cue, the brain then doesn't override and gives you the monocular cues. So you get more of a depth perception from it, from those monocular cues. So there's depth information that doesn't require both eyes, but if you use both eyes, it reduces the effect of the other cues. And horizontal displacement on the back of the retina or temporal displacement between the two eyes helps us perceive depth. This, if you're wearing a pair of 3D glasses, the apple appears out of the screen. However, if it moves towards you, you can actually perceive smaller amounts of depth. So that's actually the opposite way around of what we thought it was before. And when that happens, different areas of the brain light up. I won't go into this. It wasn't my paper, but it was one of the ones that led me down into this type of research. So bringing this back to Medicalholodeck and the presentation. So why is this sort of clip from the matrix here? So all the time we're receiving information. Okay, so our brain receives lots of information and it processes it. It processes the majority of it. It can actually suppress things that we don't want to be consciously aware of, but it'll still have processed it. And we know that because it'll process something that should look like it's moving sideways unless we use both eyes. But if you've got both eyes open, that thing doesn't move at all because your brain doesn't want you to know about it yet. But eventually, from all that noise, your brain gives you the perception of form from that noise. So a kind of key point from this is when you've got both eyes, when you're using them with the correct presentation, as you would in reality, virtual reality, placing a screen here and here, represents to the brain a proper presentation, or a presentation beyond looking at a flat screen. So that's another reason, that's kind of the reason why VR, or having a 3D view with different views for each eye, is important to detecting things when you're looking at scans. So back to the actual kind of medical bit. So thank you for mentioning that I knew something about cardiology, and to be honest, I actually don't. I came to the trust working on research databases and statistical problems and some machine learning. But actually, through using Medicalholodeck, I've learned things by preparing scans. And I'm sure maybe all of you have kind of learned things yourself just by observing models. It's a lot easier to tell from a 3D model than looking at slices on a CT scan. So back when I started, when I was at university, I think I used a very early version of Medicalholodeck. And it had a few demo models, but the imaging section, which I was really interested in trying, I couldn't use because nobody wanted to share any patient CT scans with me. And we didn't have any sort of a university to get access to. But as soon as I got to the heart and chest, I remembered the software. And that's where my kind of story with the Medicalholodeck Chris got back on track. So this is what I'm doing at the trust. So the first case, or the first thing I really did, if you can see my little video screen of my head, this was the first thing that kind of I came across. So this is for the adult congenital heart disease specialty. Now, this patient has one ventricle, their dextrocardia, and what was happening was this part here between the atrium and the ventricles was failing. It was leaflets. It was collapsed. So the pressure of the ventricles putting blood back into the lungs. So the consultants needed to prepare a model so they could explain to the surgeons what they needed to do and the way they needed to go in. But they had to find about £1,700, so 1,700, is that about $2,000 to get this printed? And they can't do that for every patient. So I introduced or came up with the idea of trying to use Medicalholodeck here to allow more patients access to having their scans viewed. So what I do, much as was described before about going in with the masking tool, isolating the structure that we wanted to look at so we could present the virtual version of that itself. And it kind of grew and moved to another area. So Magic School Bus, I think I've mentioned that maybe before, but this is a book that I remember from my childhood where you shrunk down and you went into the body, and it was great because you could learn by going into the body and seeing what it was like from the inside. And I always almost had dreams about doing that. So when the opportunity came up, and thinking back to chasing my own children around these to try and get them out of those annoying tunnels, when the anaesthetist said, we've got a tricky trachea, the intubation is really difficult. Is there some way that you can visualize this for us? I was like, yes, that sounds like that'd be fun. So I did that with the CT scan, which you can see the orange one on the left. So isolated the key bit that they were interested in, and then thought, let's press this create STL button. So created the 3D model from that, and thought, that reminds me of soft clay. So I made it quite large in the room that I had the VR set up in, and was just kind of enjoying kind of looking through it and observing all the twisting and how the narrowing happened within it. And to me, it was a gimmick. But once the consultants, the anaesthetists came in and had a look, I said, well, have a look at this. It's just kind of a bit of fun. But they actually took this as one of the most useful parts of it, that actually being able to stand inside and visualizing where they needed to go and the twists and turns that they needed to make and the subtle offset that wasn't viewable on the CT scan. They actually really appreciate this kind of, whilst it's not detailed, the actual form of it is really important, that spatial volume that's been spoken about already. And then sort of prepared other hearts from these. You can see this patient's got a pacemaker. We can highlight all these interesting structures quite easily where the sternum's been previously closed up. And just very faintly in the background, you might be able to see some of the mitral valves as well. So all sorts of patients that we work with at the trust. It's a tertiary trust, so we tend to get the most complicated patients. And I am just at the start of this process of getting this in as a service at the hospital. But it's already helped patients. It's already had a surgeon that said, I've changed my surgical plan because the calcification we thought was in one orientation is actually traveling a different way. And we were going to cut through there. If we did that, we wouldn't have been able to save the patient because we wouldn't have been able to fix it, or it would have been very delayed. So medical holodeck is having an impact on patients simply because we get to kind of play, we get to demonstrate this, prepare this for surgeons to look at and use in planning. It is a vital step and it has at least saved one life. So thank you again for listening to me talking about my kind of interest about stereoscopic viewing. But I maintain that stereoscopic viewing is beneficial to interpreting patient imaging. Your brain wants to see things from both eyes. So for that key thing, that discovery, that there's something there, there's something unusual. Please use VR and use both eyes together.